Premier Doug Ford says the updated modeling shows early signs that our efforts to stop COVID-19 are working.
We're not out of the woods yet. Far from it. We're still in the middle of a battle. We're still fighting hard to protect our long-term care homes and our most vulnerable. But today, we saw new modeling that shows there's some light at the end of the tunnel. The numbers clearly show that the steps we have taken as a province are working. And they're working because of you.
It's tough to decipher these numbers. Dr. Jennifer Kwan, a family physician in Burlington, Ontario, has been looking through the numbers and the stats that we get every day relating to COVID-19, and she joins us right now. Dr. Kwan, thank you so much for coming on the show.
Thanks for having me, Kristy.
What is your reaction to today's update and the updated projections that we're seeing?
So I think, as you just mentioned in your recap, there has been good news and bad news. So the good news is that all the Ontarians are working together, staying at home, washing hands. Every single little thing that we've been doing has kind of transferred us to the best case scenario, which means a reduction in number of cases and deaths. However, the issues in the long-term care and other high-risk vulnerable populations has been kind of become the new major presenting area of concern with increasing number of outbreaks and deaths every single day.
Is it fair to say that things are looking optimistic or that things are getting better when at the same time, the community has peaked, but long-term care homes continue to see the number of cases going up? Do you think that's a fair assessment?
I think it's two separate issues, because we do have to understand if community transmission is improving, then that gives us a bit of hope. But we do have to now target resources and monitor the situation in not just long-term care, but other areas of need. So retirement homes, home care services, group homes, prisons, homeless shelters, a lot of other places where people are now going to be at higher risk of outbreaks.
Ontario is no longer projecting how many people could lose their lives due to COVID-19, and the modelers are saying half of the deaths are now in long-term care homes, which makes it very difficult to predict. Your thoughts on that?
So based on the Ontario Ministry's numbers, there's been approximately 48% of deaths attributed to long-term care homes. However, that's not even taking into account retirement homes, group homes, things like that. So looking, if we add retirement homes into the mix, it's actually closer to 64% of deaths that can be considered, and that's still not including all those other vulnerable populations we talked about. So it's a very disproportionate number of deaths in these high-risk settings.
Mm-hmm. I'm wondering how you think this plays out, given the two paths that they've laid out for the virus, one in the general public and then the other in long-term care homes or group settings where people are living close together. Would they be able to open up workplaces and businesses and schools while at the same time being able to protect the people that live in those other communities where the virus spreads so quickly and dangerously?
Yeah, so definitely after Ontario has implemented additional measures to protect those in retirement homes, so ensuring people are not working in multiple homes, increasing testing to monitor the outbreaks in anyone who's symptomatic, that can still be improved. But for the general population, even though we may be reaching the peak right now, we have to keep in mind the curve. When we go up to the peak, we still have to come back down. So we still have to wait for the number of cases and deaths in the general population to decrease before considering opening up in stages. I believe the province is working on that, but it will have to be a slow, gradual reopening of services to ensure that we're not going to have a second wave coming right away.
And I know today the Premier was saying he's working on a framework. It'll have strict criteria and benchmarks that have to be met before the economy is reopened. I'm wondering for you, Doctor, every single day you're looking at all these numbers that are coming out, but as a family physician, how has this impacted you?
So it has definitely impacted the practices of family doctors across Ontario. We're doing most things by virtual care and only seeing in-office urgent cases, including infant immunizations and prenatal care. And And additionally, I do want people out there to know that if you're having a medical emergency, so for example, if you're having chest pain, shortness of breath, don't be afraid to call the emergency services if you're having an actual emergency. Because if you're avoiding, important care because of concerns about COVID, it can cause worsening health outcomes later on. So if you're having an emergency, you should still definitely use the emergency services.
I can tell you, doctor, as somebody who unfortunately ended up in the emergency room last week, I'm fine, but no one else was there. The waiting room was completely empty.
Yeah, and you know what? The health services have done a great job in pre-emptying some of the hospitals in anticipation for the surge, because we always want to be overreacting a little bit instead of underreacting and facing a scenario like Italy where we don't have enough resources and we're turning people away. So this is a good thing.
Mm-hmm. Well, doctor, I appreciate you coming on the show. Thank you so much.
Thank you. Have a good day.
There you have it from a doctor who's been looking at the numbers every single day, Dr. Jennifer Kwan, family physician in Burlington, Ontario.